From a health provider standpoint, like I'm all for patients having access to their own health data. And sometimes there's a bit of controversy because, some docs will say, well, if they don't really understand it, they panic. But I think that's fair, whether you tell them in 2 days or 3 days or they find out right away. I mean, if it's bad news or uncertainty news, the initial reaction is going to be panic maybe or lack of understanding, and they'll come see you anyways, right? Like just putting the ball in their court, sometimes like empowering them, it's better overall for them. At least that's my somewhat biased opinion, I guess. And there are like pros and cons to each, like do we share the info or do we just let them see it? But I think at the end of the day, the patient's responsible for themselves and it's their own body, their own health. And so, yeah, I think the less barriers to access, the less barriers to knowledge, the better.